Hello guys, welcome back to another episode of The Gist with Tanya. Now in today's video, we're going to be discussing about a very important topic, and that's Polycystic Ovarian Syndrome, also known as PCOS. Now it's a hormonal disorder that affects women all over the world. Now, I think it's important to talk about this because a lot of women are actually struggling with problems of irregular menstrual cycle, and a lot of them tend to just assume that, oh, since their periods are is irregular, then they may be having PCOS. But this might not be the case, as PCOS is just one of the many causes of irregular menstrual cycle. So in today's video, we're going to be talking about the condition known as PCOS, what PCOS actually is, the signs and the symptoms your doctor is going to look at for when they want to make a diagnosis of PCOS, and lastly, how the condition known as PCOS is managed across different patients. So what exactly is PCOS? Now, PCOS is a hormonal disorder, like I've said, and then it involves the ovaries, excessive hormones, and then the effects of that excess hormones on different body parts. So it involves the ovaries, an interplay between the ovaries, the hormones, and then other body systems. Now, what happens in PCOS is that the ovary, that's the part, the organ in the female reproductive system that's actually responsible for the production of eggs, that's the ovum, now begins to produce excess amount of hormones. And when we're talking about the hormone system around, focusing on the male hormones, that's the what we call androgen. So the ovaries begin to release and produce and release excess amount of the hormones, of the male hormones. Now, this is actually what's responsible for a lot of the signs and the symptoms that we see in patients that have PCOS. But one thing that's important for us to know is that when you walk into the hospital, the doctor does not just look at you and say, oh, you have PCOS. There are signs and symptoms we look for. There are things actually your doctor looks at for before your doctor can say, oh, you have PCOS. So there are three major things which we look at for any patient before we can say this patient has PCOS. Now, we don't need actually all three of them to be present. We just need two of them to be present before we can say this patient has PCOS. But if all three is present, fine and good. But we need a minimum of two of these things before we say a patient has PCOS. Now, the first thing your doctor is looking at for is your menstrual cycle regular? So the first thing is irregular menstruation. So most of the women with PCOS, we notice that they're having problems of irregular menstruation. So for some people, they'll notice that their menstruation is very, very infrequent. They might see it this month, and then they might not see it for the next 2-3 months. They might not see it again and not see it for the next 4 months. See it the next month. It's usually infrequent. Now, with the problem of irregular menstrual cycle also comes the problem of ovulation. So these women usually will not be ovulating properly. And some other women may also notice that their period, the number of days in which they bleed, has now become prolonged. So take, for instance, a woman that usually would, during each cycle, she'll bleed for about 2 to 3 days. But now she's noticing that, oh, she's now bleeding for about 8 days, 9 days, as the case may be. So all this actually falls under the single criteria, which is known as irregular menstrual cycle. Now, the second thing your doctor is looking at for is problems of hormonal imbalance. You know, we said that PCOS is a hormonal disorder. So the second thing which we're usually checking out for is imbalance in the hormone production. So we're usually focusing on the hormone, the androgens. Usually for women that have PCOS, when we do a hormonal profile test, your doctor will notice that the amount of androgen, that's the male hormones in the body of these women, usually is elevated. So their ovaries is actually producing an excess amount of these male hormones, and this is actually what is responsible for a lot of the signs and the symptoms that the patient would begin to show. Also, one thing we also notice is insulin, a form of insulin resistance. So we're going to talk about this. Also, it's very, very important because during the course of the signs and the symptoms as well as complications, we'll be talking about problems of diabetes. Yes, so because this insulin sensitivity or resistance actually, if not acted on and treated in time, could now lead to some of these women developing full-blown type 2 diabetes along the line. Now, we've talked about the first thing we talked about was irregular menstrual cycle, irregular menstruation. The second thing we talked about hormonal imbalance. Then the last thing which we use to make a diagnosis of polycystic ovarian syndrome is on ultrasound scanning. So usually we want to do an ultrasound scan when a patient comes in that they have problem of irregular menstrual cycle. And when we do the scan, what we're looking at the ovary. So by the time we notice that either one of the ovaries or both of the ovaries have multiple cysts. When we say cysts, they're just tiny collections of fluid. So when we're noticing a lot of this tiny collection of fluid, either in one of the ovaries or both of the ovaries, then we can say this patient has polycystic ovarian syndrome. Now, remember, I said we don't need all three of them to be present. So by the time we see two of these things present, either the irregular menstrual cycle or the polycystic ovaries on ultrasound, or irregular menstrual cycle, and we're seeing a hormonal imbalance, we're seeing excess androgen, then is a pointer that this patient has polycystic ovarian syndrome. So next, we're going to be looking at the signs and the symptoms that patients with PCOS usually have. So the first one is the most common one, the irregular menstrual cycle. So because like I said earlier at the beginning of the video, most women will just assume, oh, they have PCOS when they notice that their menstrual cycle is irregular. PCOS is not the only cause of irregular menstrual cycle. It is just one of the causes. So one of the things the women with PCOS will notice is that their menstrual cycle has become irregular. Now the second thing usually that they will notice is that they may be having a lot of acne, usually on their face, on the chest, on the back. Another thing is that they may notice that, oh, they're not having a lot of hair, facial hairs on their face, on their on the chest and on the back. Now this acne, this excess hair is as a result of the excess androgen, that's the excess male hormones that the ovaries is producing. Now for some other women, they may notice that, oh, their voice is now becoming more masculine, it's becoming more hugs, more deeper. Also, this is as a result of the excess male hormones that the ovaries is producing. For some other people, they may notice that, oh, they're not gaining weight, and this weight is majorly around the abdomen. That's what we call central obesity. Now, this weight gain is what I like to call unintentional weight gain. It's not as if you're eating or taking pills deliberately to gain weight, but you just notice that irrespective of what you're doing, you're gaining weight, not because you're necessarily trying to gain weight, but for some reasons unknown to you, you're just gaining weight, and this weight is mainly centralized around the abdomen. And then for some other women, they may notice that they're not having male pattern of hair baldness, so they start having receding hairlines, male pattern of hair baldness. This too is as a result of the excess male hormones that the ovaries is producing. And lastly, for some women, the first time they might be hearing that they have polycystic ovarian syndrome maybe when they come in for a fertility workup. So they might be experiencing symptoms or problems of infertility rather, and then they come in for a fertility workup and investigations are carried out, and then your doctor is saying, oh, the reason for your infertility is because you have polycystic ovarian syndrome. And now that we have been able to say or make a diagnosis that this patient has polycystic ovarian syndrome, how then do we manage? Now, I'd like to begin by saying that the management of polycystic ovarian syndrome is individualized and is goal-oriented. So what this simply means is that the line of management for one patient might be different from the line of management for the other patient, and it's actually dependent on the goal of the patient or what the patient is wants at that particular point in time that you're meeting the patient. So take for instance a young girl who is not married and and does not really want to start having kids at the moment. Her main challenge would be she wants her period to be more regular. She wants to see her period every month rather, as opposed to seeing her period once in 2 months or once in 3 months. So for this patient, her priority might not necessarily be, oh, she wants to get pregnant, but rather she wants her period to become more regular. So for patients like this, we give them medications to make their menstrual cycle more regular, to ensure that she sees her period every month as she's supposed to. Now for another patient on the other hand, who is probably married and trying to conceive or is having problems getting pregnant, the goal for this patient might not necessarily be, oh, aesthetics, I want to get rid of the acne on my face, but her goals may be that, oh, she wants to get pregnant. So for this particular patient, the management is usually going to be tilted towards ensuring that we increase her chances of conception, that's her chances of getting pregnant. So usually we give medications to make her menstrual cycle become more regular, to ensure that she's not seeing it more frequently. And don't forget that I said that because of the irregular menstrual cycle that they're having, they will also have problems of anovulation. Some of these women might not be ovulating, or they might not be ovulating properly. So apart from now regulating her menstrual cycle, we also want to give her some medications that will help her ovulate better, to ensure that she's ovulating more frequently as she should. This will help to increase her chances of becoming pregnant. And also don't forget that we said that one of the complications of the problems of polycystic ovarian syndrome is that it causes insulin resistance. And now this insulin resistance, if not properly acted on or treated in time, could now lead to these women developing things like type 2 diabetes or gestational diabetes along the line. So what we usually want to do for patients, also want to give them medications that will reduce their risk of developing full-blown diabetes. Then for patients for cosmetic purposes, so might want to give them anti-male hormones. We said it's the male hormones that's responsible for the excessive hair, the excessive acne. So we want to give them anti-male hormones, that's the anti-androgen medications rather, not hormones, anti-androgen medications, to help clear up the acne and the excessive hair and the voice changes that these women might be having. And lastly, we also have to education is also very, very important. We also have to educate the patient on some lifestyle modification. So we want to tell our patient that they counsel them on adequate exercise. Now, this exercise, apart from the general good exercise does to your body, improves your cardiovascular system, help with blood circulation as the case may be, and also helping with weight loss. The what's it called now? Exercise will also help to increase the sensitivity of your body to insulin, so which will further reduce the risk of the patient developing diabetes. So it's also very important, and alongside the medications we're going to be giving our patients, we also want to encourage them to engage in some form of exercise, which is going to be overall beneficial to them. And lastly, dietary control. So we want to talk about diet. Diet is very, very important and cannot be overemphasized. So eating healthy, avoiding of over processed meals, taking a lot of veggies and a lot of fruit also help the overall well-being of the patient. So that'll be all for today. If you found this informative, if you found this helpful, please give it a like, thumbs up, and do not forget to share to your family, to your friends. If you have some questions you want us to answer, please leave it in the comment section. If you also have topics that you want us to share more light on or to talk about in future videos, please do not forget to leave a comment. Drop it as a comment in the comment section, and I'll see you in the next video.